Hi everyone, happy Thursday. Today I'm gonna be joined by a very special guest, and I usually do these lives on a Monday, because this is part of the series of the Mothering and Matrescence Mondays that I usually do, and this time I'm gonna do it on a Thursday. And I have a very special guest joining me today. Her name is Clare Bourne. She is a pelvic health physiotherapist based in London, and she's actually here. And she's have a very interesting chat about pelvic health, postpartum pelvic health. And let's see if she's.
I'm here.
Yeah, Clare. Good to see you. I'm good,
To see you too.
thank
How are you
you.
doing?
Thanks for joining me today.
Good. Oh, my pleasure. My pleasure. It's great to be with
I think I
you.
met you like about, I don't know, maybe 3 years ago. We were in a festival about motherhood and becoming a mother.
Yes, yes. Yeah,
Yes,
that was
it's a
so
long time
good.
ago. I believe I just had
I
one back
know,
then.
but
Now I have two.
yes, same. I was pregnant with my
Yeah,
second at that
so
point.
it's been a long time.
Oh, yes.
Of course.
Few things have
Yeah.
happened in
So
between.
now I'm doing this series, and the idea with this is to get people to talk about the topics that might be challenging for women as we enter motherhood. And
Yes.
as I work with matrescence, that's kind of my area of experience. And in matrescence, there's everything changes, right? In a mother. So a lot of the changes are physical changes, and psychological
Yes.
changes, emotional changes, and all sorts of it.
Yes.
And today,
Yes.
I've got you to talk about a very interesting topic, which is pelvic and postnatal pelvic health. And I think
Yes.
it's such a big topic, right? I think we could talk
Yes.
about it for hours. And but let's start with. I'm just going to read your bio just as an introduction. And
Mm,
so Claire, she's a pelvic
great.
health physiotherapist, and you're gonna explain us in a minute what that means. Um,
Yeah.
she has worked extensively with the NHS before starting her private practice. She's a mom of two, and she's founder of the All About Mom, which provides postnatal education cards, webinars, and ebooks to support women in with information they deserve. And she's a co-founder of the Pelvic Health Practice, a specialist team of the pelvic health physios providing home visits across London. So tell us, what does a pelvic physiotherapist do?
Great question, and still
Yes.
one that most people are like, huh? That even exists. So we used to be called women's health physio, and then we were like women's and men's health physio. And as the area of physiotherapy evolved, we got renamed pelvic health physios. And really, that's just to acknowledge that we actually can support children, women, and men. So really, any gender, any age, with anything to do with pelvic health. Now,
Yeah.
pelvic health is a very, I think, vague term. Really, I mean, pelvic being the pelvis, and the pelvis encompasses obviously our pelvic organs, bladder, bowels, womb, pelvic floor. But I always talk about this because, so yes, that's generally where our assessment might focus, sort of as you've touched on with motherhood. Really, you can never separate one part of us and treat it in isolation. We also look at breathing a lot. We also look at how we move. We also look at the kind of psychology and our mind
Okay.
and emotions and
Mm-hmm.
how that all links together, because they're all
Mm-hmm.
connected, like pain. And if we experience pain, the brain is definitely involved. So though our focus of assessment and specialist knowledge is very much around the pelvis, really treatment and assessment is much broader than that. And we work, yes, within the NHS. There's extensive services in the NHS across the UK. Can be a little bit postcode lottery as to how long you're waiting or what services are available to you, whether it's just like one solo physio or an entire team. And there are many of us working privately. We all just work slightly differently. So I treat women and
Mm-hmm.
men. Some people just treat women, some also treat children. I treat a lot of kind of variety conditions, very perinatal, but also bowel problems as well, whereas other people might focus more on pain. So we're all trained the same, but some of us might just specialize more in certain areas than others.
That's great. So and I think it's quite interesting that you mentioned that you almost kind of need a holistic approach, because I know that postnatally, when someone is experiencing symptoms of pelvic pain or anything that is unexpected, it certainly can have a big impact in the mental health and emotional well-being as well. So it is hugely important. And so why would someone would go postnatally? When should I go and see a physiotherapist?
So I think it depends what you're seeking. So for many, they come with symptoms. So it might be if you're experiencing incontinence or kind of prolapse, so heaviness or dragging sensation, often it presents as in the vagina, or anything to do with the abdominal wall. So there's something called diastasis recti, which is a completely natural process that occurs in pregnancy, where the abdominal muscles gently stretch apart. It can be ongoing postpartum, we think, for around a third of women. And so for women like that, they might also come to us, or if you've returned to having intercourse, and that's also painful. So there's lots of reasons you might have a symptom that might then either get referred into a physio, or you might seek it out yourself. But what we're also seeing now is a lot more women being a bit proactive and actually seeking support in pregnancy, just to understand their pelvic floor, even before pregnancy. Like, actually, can I just understand my body better? Or just postpartum, like, I've not really got anything I'm massively worried about, but equally I can recognize my body's been through a lot over the last year through pregnancy and delivery, and I just like to have someone assess everything and talk me through what's best for my body going forwards. And generally I find with women, even when they come, they're like, oh, I think I'm fine. Often when you start talking, you're like, yeah, well, that doesn't feel great, or I have noticed this. And your body is, birth is a lot on the body, pregnancy is a lot on the body, and actually sometimes it's a very nice time in our lives to just take a pause, see what our body is, where it's at. And sometimes I say to women, you'll learn more and probably be even stronger post-birth, because you actually know really how to take care of it. Whereas before, I mean, I know when I was in my 20s, I just took all of it for granted. I just did whatever I wanted because nothing really was a problem, you know? So sometimes for us as women, it can be that first time in our life where we've had to really step back and think, hang on a second, like, what do I need? Like, what is my body trying to tell me? I can't just, you know, be exactly who I was before. For many reasons, we're not the same, as you've mentioned before. So yeah, there's different reasons people will come. You know, if you're more thinking preventative and proactive, that's not easily, I'd say, available on the NHS. Generally, it's more of a like symptom-based referral. But obviously privately, women are sometimes saying, I'm just going to invest in one session, get to know myself a little bit better, and that can have a huge impact. Kind of
absolutely. And I think so then someone would probably come during pregnancy, or even before pregnancy, try to get know your body and almost prepare for what you're going to go through in that process of getting pregnant, being pregnant, and then giving birth, and then postnatally. And what about when I'm in that postnatal period? Is this something that I believe that is something that all women should do postnatally?
Yeah. In an ideal world, 100%. And I think the struggle that we have is financially, unless you've got those, you know, a bit of disposable income that you want to invest that in, then it's not easily accessible just for everybody, you know, and that's understandable from an NHS perspective. There's a lot of work going on with NHS England at the minute, and there's a lot more that's wanting to be done to improve postnatal care. I don't know whether that will lead us in the next 10 years. I hope there will be big changes, but I think we're always going to be working with an imperfect situation where demand is probably always going to be bigger than supply. So I think it's just about balancing it. But what I would say is often when a lot of people start balancing, like women have come to me, this is something I say to women, but they're like, well, I decided, you know, I'd spend £100 and something on my hair, you know, every other month. This time I've just decided to put that money into a check. Because actually mentally for me right now, that's the most important thing, and I'll just delay a haircut. So, you know, I think it's not so an easy financial thing, because that's just not how I view it. But I think sometimes women find it, actually when they balance things out, it is something they could choose to invest in. I think awareness is still a big problem. I think women don't even know it's an option, that it's available, and But yes, in my ideal world, I'd be able to see everybody, assess them, and send them on their way.
And let's just say that. Sorry.
Cut out.
Yeah. Like you said, there's not awareness, and I think that's why it's important to have these conversations in all the spaces that there's support, or there's someone that's working with moms, just having that awareness, right, about how important this is, and also how some things are not that they might be common, but they're not normal, and you don't have to live with them. So there's a lot of things, and I remember when I gave birth and when I had a little one, I remember people saying like, oh yeah, it's normal that you just have a leak a little bit when you laugh or when you cough or when you run, or you're never going to be able to jump again. I know those kind of conversations that, oh, moms don't jump, kind of thing.
Yeah. Yeah.
And so what
totally.
what is normal and what is not normal when it comes to the floor?
Yeah. Great. So I think, when we're talking about postpartum, just after birth, especially after a vaginal delivery, it is very common, I'd say normal, to have some change in bladder habits, that you might get the urge and you just can't make it on time in the early days and weeks. And often what women report is, crikey, it gave me the shock of my life, but actually it did settle after a couple of weeks. And things have gradually improved by the 6-month-ish week point. Even after that, that's just a vague timescale that we use. If you're experiencing it like every time you go for a wee, it's not improving, repeatedly after 6 weeks, you're still leaking when you need a wee, you're still leaking when you cough, you do return to exercise and you can't go back to running, or you can't jump on a trampoline with your kids, like any of these things where it's very much ongoing and perpetuating symptom, that's very much not normal. So it's saying that we expect there to be some changes. We don't expect you to be fully continent one day post-vaginal delivery. We expect there to be some changes. Not everybody experiences that, but some do. But it's this ongoing, this kind of acceptance, you say, of like, well, I've had a kid now, therefore it's probably just going to be part of the picture. That is definitely not something that, and I've had women come to me like years postpartum and be like, I just want to jump on the trampoline with my kids. And I'm like, yeah, rightly so. Like, you don't want to have to stand on the side and be like, sorry guys, can't come and join you. So there's help at any point. I think that's really important to normalize, is that it doesn't mean that you have to get help at 6 weeks postpartum. If that's just not accessible to you for multiple reasons, it doesn't mean that help. I get mums that come a decade down the line, and there was some statistic, I've never quite found where it's come from, that when it takes about 7 years for women to get support or reach out for support. And I think the feeling has always been that it's around shame and actually being embarrassed. But also, like, I mean, I'm 6.5 years down from having my first kid. I can see like that first, especially if you've had 1 or 2 or 3 in that time.
Yeah, that's
pretty mental. That might be the first. There's no space, and actually that might be the first time that you've got both your kids in school, and you finally think, I could go to an appointment without a kid kicking off, without having to pay for childcare just to go for an appointment. And so I think there's a reason that it can sometimes take that long. It's not just because we're embarrassed. It's just because practicality wise, like, to only get childcare so you can go to a check is actually really hard. So so I think the most important thing is that women know that we don't have to live with those symptoms. I think some of us do at times, just because there's no brain space to deal with it, and I fully respect that. But I think it's just knowing that if you want things to change, that
absolutely. So having said that, or following that, is it ever too late?
Yeah, great question. No, I would say it's never too late. We know that from research that you can still make changes when women are at like menopausal, postmenopausal, and there are so many benefits to still doing pelvic floor exercises at that point, and you can bring about change. So it's never too late. The strongest research we have is around prevention, and I think that's why there is this big push in pregnancy to get women to do their pelvic floor exercises. I think what I recognise as a bit of a problem is we tell them to do it, but they don't necessarily understand the why. Like, why am I doing these? What's the point? What's the long-term picture of this? Is this a short-term thing? Is this a long-term thing? And really, this is where I think the conversation around pelvic health needs to become much broader, to not just focus on that perinatal period, because it's like saying, well, we're going to talk about, hello, you're very welcome. you only talk about heart health for certain parts of your life, but you don't, do you?
Absolutely.
Like, we're very aware of the importance of exercise and movement, and I think that's where our conversation on pelvic health is moving.
Yeah, and also I think so what happens when it comes to when you got a baby, you got symptoms, and there comes the menopause. So that is another. Does that have an impact in your pelvic ability to, you know?
In our pelvic health overall, definitely, because the vaginal and vulval tissues are they've got lots of estrogen receptors.
Okay.
So that decline in estrogen that happens perimenopausally into like postmenopause does have an influence on the tissues. It doesn't seem to be that it's just like a direct impact on the pelvic floor, that suddenly your pelvic floor just becomes 100% weaker. But we also know that there is kind of loss of muscle strength tissue as we age. So the pelvic floor would fit within that category. But we think a lot of the symptoms are actually just down to changes in the vulval and vaginal tissues due to the estrogen reduction. But again, there is some research that suggests that pelvic floor exercises can help with like blood flow to the area, which can also really help with the tissues. So again, there's still lots that we can do. Maybe use like a topical estrogen in the tissues as well, so like an estrogen that's just in the vaginal tissue. So
yeah, so then treatment really depends on every single body, circumstance, delivery, time that you've experienced symptoms. So I guess there's like a whole range of treatment. But more or less, like, what does it mean to get treatment? Is it just do your Kegels? Is it what kinds of treatment are they available?
Yeah, which is a great question, and I think this is I think pelvic health or pelvic floor has just been very much just do Kegels, and I think the concept of a Kegel is very much people just identifying if you just tighten the vagina and that's, you just do that multiple times. I think where we're moving to is like pelvic floor musculature, pelvic floor rehabilitation is so much more than just doing some squeezes. It's getting the pelvic floor, the way I like to view it is in different ways. We need the pelvic floor to be strong, we need it to be flexible, we need it to be coordinated. So it's not just looking at the isolation of can you squeeze your muscles and let them go. We need them to be able to do the right thing at the right time through movement. So if you're working with a physio, yes, probably it will start off with us assessing your pelvic floor and seeing what its mobility is like. Is it moving well? Are you able to squeeze well? How's your brain-body connection going? Doing it in different positions, thinking about the activities that you are struggling with, and train your body for those. There's I always say to people, make it specific, ultimately. And I think that's where the whole Kegel concept doesn't actually translate into real life, because most of us as mothers are not struggling when we're sitting or lying down. We're struggling when we're upright and we're mobile and we're chasing our kid down the street. And I would say, within other physiotherapy practice, if you had a problem with your hamstring and your goal was running, we wouldn't just get you doing exercises lying down. We would get you doing exercises that replicated running is part of your rehab program to get you ready for running. Exactly. So when you think about it, it makes logical sense that with the pelvic floor, we just say do some Kegels and then run. But it's like there's a number of steps between that we would do for any other body part that probably we need to support the pelvic floor with as well. So I think this is where working with the physio, it will look different, as you say, but generally it's going to start with that, really understanding your goals and working back from that point, where you are now and how we bring those two together. And obviously we need to look at the vaginal tissues, like how are they doing? Are there any problems that we need to address? What are your bowels like? Are you actually really constipated as well? Are you actually also experiencing bladder symptoms, which could be completely influencing how your pelvic floor is functioning? Like, it's about really doing the whole web and working out for you as an individual, what are the bits contributing to your pelvic health that we need to address. It's not just Kegels. If it was just Kegels, to be honest, we probably wouldn't have a job.
It just be your Kegel.
Who would pay us to be like,
which is funnily, this is what I hear a lot with moms, is that I just so I've got symptoms, I'm experiencing leaking, so I just have to do my Kegels, and then people are doing like 3 times a day, 10 times, and then the long squeeze, the short squeeze, and that we think that that's it, but essentially it's you need for your specific situation just a specific treatment, so it's completely personalized. So definitely worth that's when you come in, right? That to do that specific and personalized treatment. And so there's one topic that I would like to just talk about, which is something that I never heard about before I was a mom, which is that the fecal incontinence. So that is the other side. This and I heard this. I saw it somewhere. Maybe I don't know how outdated it is. It was a statistic about 1 in 3 women experience urinary incontinence, and 1 in 10 experience fecal incontinence after childbirth. So I thought that was a huge. I was shockingly surprised about it. And in that, so what causes the fecal incontinence? So why does it get that? Because we think, okay, when I thought about, giving birth, childbirth, okay, I understand that the vagina and almost the urinary incontinence, but why do we get to that? What causes that?
Yeah, so I mean, during delivery, sometimes any tearing that might occur does involve the anus. So it does involve the anal sphincter. So around the anus, there's sort of 2 little rings of muscles. We've got sphincters at lots of places in our body. They're basically rings of muscle. There's one in your top of your stomach as well, which sort of stops reflux, which during pregnancy we often find out about. But during delivery, obviously, the anus is very close to the vagina opening. When there's a tear, sometimes it extends down into the anal sphincter. So if there has been injury to the anal sphincter, that can be one of the most common causes for fecal incontinence or flatal incontinence, incontinence of wind as well, or like a decreased awareness of when you need a poo. So you might actually get quite a lot of urgency as well. So I'd say that's a very common one. So equally, you could be someone who's also experienced a lot of constipation in the past. You've strained an awful lot to open your bowels, which has also caused weakening of the tissues, or pelvic organ prolapse, which can also, and this is where again it's just working out for you the whole picture. There can be different reasons why the pelvic floor might be weaker, or the anal sphincter might not be functioning as well, or your awareness of needing a poo might change. So yeah, lots of different reasons why. I'd say in the postpartum community, often it's related to a tear or a missed tear. So that's why I would say to women that if you're experiencing fecal incontinence or wind incontinence, like you literally are not aware you need to pass wind and you pass it, and you're like, crikey, that's really embarrassing. For me, that needs investigation as to why. Sometimes tears are missed, but you are very much someone who I think really needs investigation, needs support, and needs rehabilitation individualized to you. It's not just go do your Kegels and see what happens. We need to understand why.
So definitely, I would say if you have a tear or some sort of tear, first, second, or whatever, definitely worth getting yourself checked by a women's health physio just to make sure. So where are you, what your body is, and what that tear has damaged.
Totally.
Right?
Yeah, absolutely. And ultimately I always think, like, if we had a tear in any other muscle, I mean, you'd never normalize it as just something to crack on with. We would often give very individualized support for that. Equally, you hear of athletes having hamstring tears. It's all slightly different origin, but muscle tears to some degree, and they rehabilitate and they're able to get back to things like the Olympics. So the body has an amazing ability to change, to re-strengthen, but we need to give it that right support, and it's not just simply do Kegels and see what happens.
In terms of like how much success rate there is of actually getting from, I guess of course it depends on each specific situation and experience, but is there like you will get better? Is that a message you would give someone?
Yeah. I mean, I think that we have to be completely honest. When you're looking at medical management, you're looking at conservative treatment, which is more your exercise, your supportive devices, that sort of side of things, and then you've got surgery. So when we're really thinking about pelvic health, really what we're saying is we're focusing on your symptoms and your quality of life. That's our focus. So yes, for the majority of women, we can make a significant improvement in their symptoms and hugely in their quality of life. Yes, we don't help everybody. Yes, there are some times where there has been structural changes that it's beyond physiotherapy help. It's beyond conservative management help. but there is an awful lot of the population where actually, surgery is absolutely not needed, and conservative management has a huge impact. Sometimes we have to be realistic about what we're trying to achieve. Maybe it wouldn't be running a marathon again, but consistently doing a nice 5K. But equally, there are supportive devices like things like pessaries and support shorts. And for me, it's really understanding a woman's needs, her goals, and getting her back to those. For me, if we've managed to do that, whether she could be exactly the same person as she was before is often not a woman's goal. Often it's like, you know what, I actually just want to be able to go for a 5K run to give me some mind space from the kids, from work, and that's my goal. Great. She might have in her past life run ultra marathons, but she's like, I'm actually really okay. I haven't got time for that anymore. So this is what I think is like, what are our goals? And actually for most women, I find who come to me, we achieve their goals or hugely get close to them. And then make that, I think a lot of it isn't for women, it's us feeling confident in our bodies that we can trust them.
That's great. That's good to hear. And absolutely, and I think that I just hit the nail of saying, actually, what do you want? What is your goal? And I think also important here to say is that actually you might not be actually interested in going into doing the marathons that you used to do. So what is it that you want to achieve? And there's a lot of when we talk about that self-reflection of saying, okay, because I think there's a lot of there might be a lot of shame attached to it, and a lot of a bit of grief of saying, okay, my body is not what it used to be, and I'm not that 20-year-old who could do like whatever, run and jump and but then that's a lot of a psychological and emotional process to go through and accompany someone through.
Huge. And I think that's a huge, I really appreciate you saying that, because I think that's such a huge part of the postnatal journey, whether it be physical, you see a clinician or otherwise. Because I often say to women, like, for me, myself, I kind of had to come to terms with that my tummy skin is not the same as it was when I was 21. And it's never going to be, partly because I'm nearly 35 and partly because I've had 2 kids and I've got some stretch marks. Now, I think in some ways we can come to peace with that. But sometimes when it comes to our pelvic health and the fact we've got some vaginal changes, it becomes a bigger psychological barrier because of the fact it's internal, it's our vagina, it's linked to intercourse, it's linked to how we feel as a woman. And I do agree with that grief thing. I think I've definitely done that process to some extent. And I think sometimes it's coming to an acceptance point that our body has changed, but that change doesn't always mean that we can't do what we love anymore. And I think we often correlate with like vaginal changes equals this can't be happening anymore. And I think that is a huge, but you can't really do that until you put it all out on the table and piece it together. And I think we don't often realize that's how we're feeling. And we almost don't feel it's okay to feel. There's a lot of this kind of like, I guess it's like gaslighting, isn't it? In the sense of like, well, you've got a healthy baby. Be grateful you've got a healthy baby. And that is, no mother, I don't think, is ungrateful.
But it's not just about that.
Baby. They also, it doesn't trump any other emotion that you're ever going to feel again about your own body and your own self. And I think that's where we have to really hold that tension of like, there is gratitude. We're so thankful that we get to be mothers. And I think the majority of us would say it's 100% worth it.
Yes.
But however,
that's right.
there are sideline challenges that we need support with. And that's absolutely valid.
Yeah, absolutely. Someone asked here, can you touch a little bit on prolapse? Can you recover from this with pelvic exercises?
So let's just briefly talk about what prolapse is. So when we're talking about vaginal prolapse, we're talking about there being one of your pelvic organs, bladder, bowel, womb, be moving from their original position. Often it presents with a kind of this heaviness, dragging feeling. So there's a variety of different types of prolapse depending on the organ, the grade, and your symptoms. There's 3 kind of quite huge things that vary. We have some research that suggests that with regular pelvic floor rehabilitation, so again, not just do your Kegels, go and see a physio. First line treatment, which is stated in our guidelines in the UK, is supported pelvic floor physiotherapy for at least 3 or so months. And really the research suggests that we probably need to be doing that rehabilitation for around 6 months to really build up pelvic floor strength. So this can improve your symptoms it doesn't always change
Yeah.
the structural change. And I think this is where it becomes really difficult for women. On examination, we may still see a prolapse, but your symptoms and your function completely changes. So I guess the short answer is yes, you can recover it from a symptom point of view, and your life can completely change on examination though. But most women don't really care about examination. They're like, I mean, I don't really look down there regularly. I'm not bothered that probably there are some vaginal wall changes. What I really care about is that I'm uncomfortable, that I'm struggling to, you know, run, or I'm struggling to just walk around, look after my baby without fear. That, yes, I think we can hugely change. I know we can. We do it every week in clinic. So yeah, definitely big changes.
All right. And finally, let me see what else was I wanted to ask you today. I guess I think we've covered more or less everything that I wanted to talk to you about. And I think just to stress about, you know, how important this work is, and how important it is to talk about this and have these conversations and be open about our symptoms, about our feelings, about emotions, and like we've just been talking about, it's just our body is changing. Oh yes, and the other topic that I wanted to say, or the thing that I wanted to share with you, is about that acceptance that our body is changing. That comes a lot of pressure with there's a lot of pressure from one side to bounce back to your body, to bounce back to your old genes, to look almost as if you didn't had a baby. So what do you think about that?
Yeah, I think we need to have big conversations about this, because I just think there is so much pressure. And we have to accept that some women, there's been a lot of talk this week on social media about a famous person who's put up something about his wife. And, you know, I don't judge him for talking about her aesthetics. I think it's totally fine for people to have aesthetic goals. I think that we need to hold space for that. You don't have to become a mother and not want to look like yourself again. But it's about realistic expectations. And I think that's what we don't do for women. And accepting that we probably don't have the same access to the gym or exercise or how we feel. There's so many barriers to exercise or eating well, or what all these contributing factors are. And I think I always say to women, you need to we think about it in like 6 weeks, 12 weeks. Oh, I'm out of the fourth trimester. That's that trimester done. You know, oh, I should feel like me again. I think most women feel most like themselves around a year. And that doesn't mean you don't feel like yourself at all for that first year. I just think for the average women that I meet, they're like, it just took much longer than I was expecting. And actually, I wish someone had said that to me, because I probably would have felt a lot better. I know myself physically. I'm 3 years after my second child, and I'm probably the closest I am to how I was prenatal with my first in 6.5 years from a aesthetic physical perspective, because I just have a bit more time. I'm sleeping better. I'm not reaching for boxes of biscuits every 5 minutes because I'm so tired. I've survived a pandemic with 2 kids. There's a lot. And so I think, you know, not that has really been my goal. It's just kind of been the natural way my life has gone. But I think if someone had said to me, listen, give yourself 6 to 7 years and you're going to feel way more like yourself again, I probably would have felt better over the last 6 years to be a bit more like, okay, this time will come. But these early years with tiny children are really exhausting, and I have to be really gentle with myself. So I really struggle with the bounce back concept. We don't bounce back. We literally do not just anatomically bounce back. It doesn't work. Genetically, some people aesthetically can look very different at 6 weeks postpartum from a collagen, skin, muscular perspective. But there's so many factors that feed into that, from our sleep, our support, our nutritional, who we were before, how much we've been able to train during pregnancy, our wellness. Did we have hyperemesis, not have hyperemesis? What's our birth been like? Was it traumatic? When you make a web, you're like, and there is so much.
Absolutely. And this is what we talk about when talk about, you know, the matrescence experience. Everyone's matrescence experience is unique, and it's so many things around you that can influence that experience. And I like that you talk about, you know, how it takes time, and now you feel more like yourself, and then slowly you get there. And this is about the season where you are, and it's just about accepting where you are in that season. And we're gonna move through different seasons, and just do it with more kindness and compassion, and always looking at our body, and always looking for help and support whenever we need it, but just having a little bit more acceptance of where we are. Great.
Totally.
Well, thank
Love
you,
that.
Claire. Anything else that you would like to
You're
share?
welcome.
Any advice that you want to give?
No, I love all of this. I think just that intuitive and compassion for yourself, whether it be mentally, physically, and also just that you are one. So though we love to very much compartmentalize, everything plays into each other. And so often when you start to help with one thing, it will help the other. And that sort of idea, I think that holistic, though that is such a buzzword now, it is true. Like, we are one body, and I think
actually,
talk about that
and we're not compartmentalized individuals, right? Yeah, great.
Absolutely.
Well, thank you, Claire, for joining me today. So where can people find you if they want to find you?
Yeah. So, I mean, social media, obviously, my page is here. My website is like clare-bourne.com. If anyone wants to email, there's a link there to email through. So that's probably the easiest ways to find me. And then, if any, obviously, clinically, we can advise you on different clinic options and stuff like virtuals, home. I try to just do a spread because I want there to be accessible support where possible.
Thank you very much. Thanks for joining me today.
Amazing.
Bye. Have a nice rest of the week. Bye.
Bye. Bye-bye.
Thank you, everyone, for joining me today. That was Clare Bourne. And next week, we're going back to Mondays. So I have a very interesting conversation about the parental brain with Rocio Suni. She'll be joining us talking about brain changes, and it's going to be very interesting, very different to what we had today, but also very important when it comes to the changes that we experience as we become mothers and through matrescence. So come and join me again next Monday, and I'll see you later. Bye-bye.